If I asked you to flex and extend your hip, you'd probably do something like this. But you can also move your hips without moving your legs. Like this, like this, like this, like this, and of course like this. The research shows that postural control and core stability exercises can help to reduce hip pain. So try any one of these exercises that I've just shown you 10 times, 3 times a day. This is the pelvic tilt, lying on your back. From this position, place your hands over the side of your hips so you can feel what movement is occurring. And then you want to tighten your tummy and flatten your spine so that the lower part of your back presses down into the ground or the exercise mat. So you flatten the spine, and at the same time you can see the pelvis is tilting up, tilting this way. If I exaggerate that movement there, you'll see that we achieve this pelvic tilt. Okay, so a small movement or a larger movement is all about control. 10 times, 3 times a day in order to get the control through that core area. This can also be done in the quadruped position. So we're up here, nice and stable, or of course on the floor, on an exercise mat is often preferred. And then you're going to arch your back, stick your bum out, and then round your back and tuck your bum in. Arch. Okay, so curve the back and arch the back. Curve the back and arch. In the seated position, place your hands over your pelvis so you can feel the movement occurring, and then sit up straight, sticking your bottom out and arching your back, and then tuck your bum under and let your spine curve. 10 repetitions, and you can do any one of these exercises or mix and match them for variety. We also did that in the standing position. Slight bend of the knees, tilt and tilt. Flex and extend. That pelvic tilt exercise, whether you're lying on your back, kneeling, seated or standing, is an excellent way to get started to work on your postural control and core stability to help reduce your hip pain. So that will count as just the first exercise. Remember, I'm going to show you 3 exercises, so 2 more. The next one, lying on your back, remember the pelvic tilt again. So tilt the pelvis, except this time tense up your bum muscles and push your pelvis up towards the ceiling so that your thighs come into alignment with your spine. And many of you will know this exercise as the bridge, because you're making a human bridge. And back down again. Make sure you keep your breathing steady. There's no need to hold your breath when you do the exercise. Hold it for a few seconds and back down. I would recommend starting with sets of 10 repetitions and doing that 2 to 3 times during the day. You could do it all in one sitting where you do 10, rest for 1 minute, and then do another 10, rest for a minute and do another 10. Or you could space them out throughout the day. Now, if you've got some exercise equipment at home, I'd recommend getting a small resistance band. If you don't have one of those, you could probably use a belt. So I'm going to go ahead and pop this band around my knees, and it's then going to give me a bit of resistance as I push out against the band. That outward movement we call abduction. So now there's 3 components. Tilt the pelvis, lift into the bridge, and push out against the resistance. Hold for a few seconds, bring the knees back together, lower the bridge and relax the pelvis. Tilt the pelvis by flattening the spine and tilting the pelvis towards you. Lift into the bridge, push out against the band, hold for a few seconds, bring the band back in, lower the bridge, relax the pelvis. One more time, tilt the pelvis, lift into the bridge, push out against the band. Bring the knees back together, lower the bridge and relax the pelvis. Give us a thumbs up if you like this exercise and let us know how you get on in the comments. This next exercise involves a little bit more coordination and stability. So kneeling in all fours with your knees apart and hands apart so you feel nice and stable. You're going to do 2 movements. Movement number 1, choosing which leg you're going to exercise first. Take the leg out to the side, and back in. Okay, so that's hip abduction, and that's exercise number 1. You could perform 10 repetitions of that. The second part of this exercise is to extend your leg back so that you're tensing up your glutes and putting your leg out in a nice straight position. You could do 10 repetitions of that one, or you could do the movements combined, like so. Take the leg out and extend the leg back, and then bring it back in again. Out to the side, extend out behind you, and back in. While you're doing the exercise, you've got to stay nice and stable, and as you move the leg, you want to avoid twisting your body so that your core is working hard to keep you nice and stable. Don't forget to have a go at doing the other side as well. So these exercises should not cause any hip pain. If they do, then stop doing that particular exercise and try and continue with the other exercises which hopefully aren't causing you any pain. As always, I advise you get some professional one-to-one assessment if you're experiencing any pain. If you're finding this video and my other hip videos helpful, then you may like to know that I have an online course which focuses on the assessment and management of hip impingement. The link should be showing on the screen here and is also in the description below the video. As for now, please continue to the next video to learn some self-massage techniques for hip pain.